representatives from Anthem. We've got Aaron and Capri here with us to help answer some of your questions, as this is also a new policy to us as well. And then, of course, we have the expert in the room, Jay Scott. He's our broker from USI. He's going to be picking up the presentation. This truly is an open forum, folks, so please, as you have questions, raise your hand. We'll popcorn around the room and answer them as we can. Mary Fortney is off this week, but she has been sending out some emails, and I know you get inundated with emails from us, but please pay attention. She sent out all the forms that you need. I do have some hard paper copies if anyone needs it, but please know she is a team of one. We are also learning along with you, so be patient. She's trying to answer as many questions as possible, and we'll also direct you to the Anthem website, which is a wealth of information. So please, very casual, ask your questions. I'm going to turn it over to Jay here.
Good morning.
Good morning.
So if Nikki thinks that this is exciting, she must have a boring life. So we are here to talk about open enrollment once again.
So let's talk about the new technology.
Okay. So it is that time of year, open enrollment. It runs starting today until November 15th. And today we'll talk about the process a little bit, what's changing and new for 2024, what's not changing for next year. Then Anthem will take over and... You sure? Yeah. Okay. It's not going to blow up or anything? No, I like it up here. Okay. Sorry about that. And then Anthem will take over, talk about their program, the services, the benefits to you. I'll come back on, talk about a summary of your other coverages that you can think about and do things with at open enrollment time. And then lastly, I'll just reiterate some of the things you have to do and some of the things you have to think about. So I promise you, you're all going to be happier this year, right? Excuse me? I heard that. So as far as the enrollment process, if you want to keep everything the same, you don't have to do a thing. Even though we're changing medical insurance, but you want to keep your medical election the same as far as single family coverage, who's covered, who's not covered, we are going to automatically move you into the Anthem program without you having to do any paperwork. So the only paperwork you're going to have to do is if you want to make a change in your medical election, or if you want to make a change in any of your other election or choices. The exception to that is flexible spending and dependent care. Who participates in one of those accounts? All right, so you know that starting last year, you need to go out online and make your election, your contribution election for 2024. So Mary sent you all a flyer on how to do that. Also, Nikki does have some flyers with her with the instructions, but again, that cannot be automatically re-enrolled for whatever you elected last year. You're going to have to physically, if you don't have an account and you want to participate, you have to go out online and open an account. And if you do have an account and you want to re-up for 2024, you have to go out online and make your new election. And for 2024, the maximum amount you can put into your flexible spending account is $3,200. It was $3,050 last year, so the IRS jumped it up pretty significantly this year from a percentage standpoint. And the dependent care account election is still $5,000, unfortunately. Daycare has become horribly expensive, but the IRS has not changed that amount in over 30 years. And then the only other thing you have to do if you do want to make changes to any of your coverages, medical, dental, vision, your elections, two places you can get the forms. Nikki has them here. You can grab one before you leave if you know you want to do something different with your medical, dental, or vision coverage. Or you can go out on the Fond du Lac County Human Resource website and click on 2024 open enrollment and print off what forms you may need depending upon what you want to do. Any questions so far? Okay, and all this fun ends at 3 o'clock on November 15th. So don't try doing anything at 3:01. Nikki and her staff will deny you. Okay. So what's changing? We're leaving Dean Healthcare. Yeah, that was delayed reaction there. And we're moving to Anthem Blue Cross and Blue Shield, which means a lot of good things for you. Number one, you're going to get your broad network back. All right? So I dare you to try and find a provider or a healthcare system in Wisconsin that's not in Anthem's network. So it's bringing Aurora back, bringing Freighter back, Ascension is back, St. Elizabeth Hospital up in Oshkosh, Theta Care is back, etc. All right? Also, one thing you haven't had for many years is you haven't had out-of-network benefits. With Anthem, you will have out-of-network benefits just in case. All right? Just in case something happens that ends up being out-of-network, you do have benefits under this program for out-of-network. Otherwise, everything else is pretty much the same, except there are a couple other enhancements with Anthem. So today, you have a separate out-of-pocket maximum for medical and a separate out-of-pocket maximum for prescription drug coverage for the calendar year. So they're segregated, all right? With Anthem, you'll have one integrated out-of-pocket maximum. So to give you an example, today you have a $3,500 medical out-of-pocket maximum for single coverage, $1,000 for drugs for single coverage. Together, that's $4,500 out-of-pocket. Your one single out-of-pocket maximum with Anthem will be $4,500, all right? Another change is today with specialty medications, you have a 30% copayment with no monthly maximum. With Anthem, you have that same 30% copayment, but you'll have a $350 maximum each month. And that's pretty much it, other than what we call provisional or administrative changes. For example, one thing I can promise you is that Anthem's prescription drug formulary will not be the same as the formulary you had with Navitus under Dean. All right? Now, I believe Mary sent out some formulary lists to you as we know them today. You can also, even though you don't have your ID card yet or you're not set up with Anthem yet, you can go out to their public domain site and look at their formularies if you question a certain drug or drugs you're on to make sure what your coverage will look like. And use the instructions to do that in those booklets that were given to you. Because you have to make sure you pick the right formulary, and that's all described for you in those Blue Cross booklets that we handed out today. The other thing, as long as we're talking about drugs, is I did get a pre-authorization list from Dean, and I did give that to Anthem, because obviously some drugs you have to go through a pre-auth process. We're trying to avoid you having to do that twice within a 12-month period. Okay. Also with Anthem, you will have a much broader preventative drug list or drugs that are covered at 100%, no money out of your pocket. You can view that on their public domain site. It's called the Essential Formulary. Any questions on anything I said so far?
What was that called? Essential what?
The Essential Formulary. Yes, ma'am.
On that list, it says at the top of things at no cost or lower cost. So if they're on that list, are they all no cost or is there no cost?
It would all be no cost under your benefit plan, so $0 copay. That would be your experience at the pharmacy.
All right. Yes, ma'am.
A mail order portion for maintenance?
Yes. So unfortunately, we can't transfer your mail order accounts from Navitus to Anthem because of your credit card information. So you should go out as soon as possible after you have your ID card and get that mail order established. What I would also suggest that you do is try to get one more prescription, especially if it's a 90-day supply, in December, so that you can buy yourself a little more time to figure out what's going on with your drug and the formularies with Anthem, and give you time to set up that mail order account. And even if you don't have an early refill, it's still possible to call Navitus and ask for a vacation override. And that way you can usually get a drug even 2 weeks earlier or so, 2 or 3 weeks earlier than your otherwise early refill limitations. And you're not lying to them, you're just asking for a vacation override. You're not telling them you're going on vacation, right? Okay. All right, any other questions? All right. So your contributions for 2024, depending upon if you have single or full-time, single, full-time family, part-time single, part-time family, are increasing by 2.7%. So a pretty small increase these days. That's probably a third of what national averages are for 2024. And also a reminder that you had to complete your status level under Goal 365 by September 30th of this year to get the lowest contribution toward your health insurance, which is 12% for full-time staff. And as far as getting your health insurance credit for 2025, we're still figuring that out yet. The county has to make some decisions on a few points. We'll communicate that later this year. All right, but it'll probably be a little less complicated than what you had to do this year as far as gaining bronze or silver status. So besides Anthem Blue Cross being new, I think you all know by now, Goal 365, Humana Goal 365 is going away. That's because they got out of the wellness business along with the fact that they've gotten out of the health insurance business. All right, so Humana will not be selling wellness services, will not be selling health insurance starting in 2024. Your dental benefits are not changing. Dental rates and benefits are staying the same. However, I did get one enhancement on that program for you. So today, if you have a crown in the rear, on your rear teeth, back your mouth, it has to be metal to be covered. Starting next year, it can be porcelain or a white crown. And also, maybe Nikki will want to add some information to this, but your health insurance premiums are going to be changing for 2024 as far as when they're deducted from your paychecks. Today, they take a deduct, so let's say it's for October's payment to the insurance company, Fond du Lac County took your deduction in September. So they always took it the month before the current payment was due. Starting next year, they're going to take it the month of. So for example, this year in November, they will not be taking a deduction off your paychecks for December. I said that wrong. This year, they will not be taking a deduction in December for your premium in January. They'll be taking that in January. Okay. All your other deductions for dental, vision, long-term disability, those will continue to be the month before the current premium is due. Any questions on that? What?
Yes, so, yep, the payroll system is still gonna be the same, the health insurance on the first payroll of the period, and then dental and vision on the second payroll, but for the month of December, you're not in for health only, because January, we're gonna pull for January.
So Nikki's,
And as a Christmas bonus.
well, Nikki's BSing you because you did pay that money, you just paid it earlier this year, right? So it's not a free month, but you know, if you want to feel like it is, go ahead. All right, now it's my time to give you my annual pitch on taking better care of yourselves, improve your health, improve your behaviors. And what I'm going to show you here is evidence supporting having a relationship with a primary care provider, whether that's Cynthia at the Fond du Lac County Care Clinic, a doctor at Aurora, a doctor at SSM. It's very important to have a quarterback for your health, and that's what a primary care physician is. And USI has over 857,000 adult members in our claims database. And so every year we do a study comparing two cohort groups. One group that had some sort of an encounter with a primary care physician or a wellness visit, routine physical, and the other group that did not. And the results are pretty remarkable. The people that had a primary care provider and saw that provider, their inpatient admissions were 31% lower ER visits were 9% lower, average length of stay was 19% lower, and readmission rates to hospitals were 47% lower. So that's pretty telling as far as having that primary care relationship. And a big part of that relationship is early detection. So cancer is an easy sickness to pick on relative to early versus late detection. So if you take colon cancer, stage 1 colon cancer, 91% of those people are going to be cured. Stage 4, it's only 14%. Prostate cancer and breast cancer, 100% curable if caught in stage 1. Right? So very important to get your recommended age and gender screenings, colonoscopies, mammograms, etc. So what's not changing, the Fond du Lac County Care Clinic will remain in place as part of our arrangement or negotiation with Anthem. They agreed to continue funding that on the county's behalf for all of you. Your Delta Dental program, for those of you enrolled in a dental, the rates are not changing, the benefits are not changing, other than what I explained regarding porcelain crowns on your back teeth. If you're enrolled in either vision program, the materials only, or the full service, that also includes an exam, those benefits and contributions are not changing either. And there's no change in the offering relative to long-term disability. It's still being offered and will continue to be offered for those of you enrolled with Prudential. And lastly, last year we replaced ComPsych with SSM for your EAP services. That will be remaining in place as well. So SSM will still be your EAP provider. So before I turn it over to Aaron from Anthem, any questions of me or for me? I'll come back on in a little bit. Yes?
I have one question. So if I'm taking someone off my health insurance, I don't have to do the re-enrollment stuff, do I?
Well, you have to fill out a change form taking them off.
Change.
Correct.
And do I have to do that by the 15th?
Correct.
Okay.
Anything else? Okay.
How does that sound? All right. Well, good morning, everybody. My name is Erin Jeffrey. I'm with Anthem. And my colleague Capri is here as well. We are so excited to be able to share a little bit more about some of the resources that will be available to you and your family. We'll have some time at the end to be able to have more sidebar conversations, so feel free to catch us towards the end of the presentation. But as Nikki had shared, we want this to be interactive. If you have questions about what I'm saying or have questions about something you see in this great booklet that you think is worthwhile for the group as well, feel free to raise your hand and we will address that question. So a little bit more about Anthem Blue Cross Blue Shield here in Wisconsin. We are also considered a large employer inside the Wisconsin. We've been around for 83 years. Of course, many of you probably know that because we used to have a large brick and mortar office over towards the interstate. So we have been in your community. We have many associates that still live inside your community as well. We have over 1,200 associates that live and reside inside Wisconsin, even though Anthem Blue Cross Blue Shield encompasses 15 different states when we start taking a look at Anthem as it compares to Blue Cross Blue Shield. Jade made reference to our network, which we're going to be talking about our Blue Preferred Network. It encompasses 95% of all licensed doctors inside Wisconsin, 96% of the hospitals, and then 97% of all of our claims are paid with an in-network provider. And really, why that's 96% is because there are some different Veterans Affairs or VA hospitals that are in our state and not in our communities that are not contracted with any different insurance carrier. So that's the only reason why that's not 100%. But a little bit more about the Blue Preferred Network. There is also a map inside this booklet that is not as finite as what it is up here on the screen. But when we talk about Blue Preferred, that is the network that we reference for your services and for your doctors and hospitals inside the state of Wisconsin. But rest assured that all of the major healthcare systems are a part of our Blue Preferred Network that's available to you and your family members. Now, your coverage also offers nationwide coverage, and the coverage that you'll have, what we call a WRAP network, is going to be utilizing the Blue Card PPO. So just know that if you seek services or you have a family member outside of the state of Wisconsin, you also have access to our nationwide provider network. Now, nationwide, yes, we are Anthem, but we also provide with that Blue Card that you and your family have access to Blue Cross Blue Shield providers all throughout the country. And in fact, 1 in 3 people in America have a Blue Cross Blue Shield ID card inside their wallet. So it's one of the largest nationwide networks that you will have access to. And once again, the PPO will be for services outside of the state of Wisconsin. Now, a little bit more information about the different tools and resources that we also will have access to be able to provide to you as of January 1st. When we reference here our Sydney Health app, this is what we call the member or the employee portal. This is very similar to resources you probably have had before in the past, but our solution to member education and member access to information is using Sydney Health, which is the app. You also will have the ability to open up and provide your username and password on anthem.com as an employee or a member. You'll set up that username and password, and it's going to be single sign-on using, if you're accessing it on the computer or if you download the free mobile app, which is Sydney. And you'll see that cute little icon there at the bottom of the screen. That's what that Sydney Health app icon is going to look like. Sydney Health is able to offer you all of the information that you need about your benefit plan, whether if it's finding care or checking costs. So after the first of the year, you'll download the Sydney Health app, and you no longer will need to remember that I have the national network that you have to seek out on a separate public website or be able to pull up your prescription drug formulary. All of that will be built behind the scenes, and then the information that you access on any of the employee portal information, that will be your already set benefit plan networks and formulary. So you'll no longer need to reference that from a name perspective. We also talk about checking cost. Sydney Health has amazing resources as you start to become further educated about what it costs for the different types of services. You'll be able to not only find out who is in network, just to verify that you are using in-network providers, and you'll also be able to determine, is that going to be a specialist copay? Is it a PCP copay? You'll be able to also see where you are with tracking towards your deductible and out-of-pocket limits. Now, I mentioned about checking cost as well because we have a very robust transparency tool, especially as you're taking a look at the cost of medicine. It will have your formulary loaded into there as well. So let's say, for example, you have a new prescription drug that your doctor has prescribed. You'll be able to go onto Sydney Health, enter in the name of the drug, the dosage, the milligrams, whatever that dosage is. You'll enter that information, and not only does it show you the local pharmacies that will be able to dispense the medicine, but it's also going to tell you what the cost is at those places as well. So you'll have the information when you go that you'll know it's going to be a tier 2 drug, and that's what you can expect to pay when you get there to the pharmacy. Especially now with, yes, we do have enhancements to your specialty medication. It is capped off at $350, but you as the consumer, you're still paying that 30% up front. You're gonna wanna make sure you're going to the best place so that you can pay the less money out of pocket, and you'll be able to have access to that information at Sydney Health. This is also where you can go to see all of your benefit information and claims. So if you have a question, you received an invoice from a doctor, you want to make sure that the benefit has been processed through the insurance. You'll be able to see all of your explanation of benefits online as well. That also helps out with that substantiation with your flexible spending account, knowing that you have access to that information electronically on Sydney Health, where you can download and send an email. Yes? Question was, can I see the claims of my children? So caveat to that is that with HIPAA, there are some privacy. So depending upon the age of your children, if they're over the age of 16, you will not see their claims online, but you would be able to set up, they would create their own username and password, and then they could allow you to have access to that information. But it's not going to be on your portal. But myself, I have 2 minor children. I can definitely see their information online, but I cannot see my spouse's. When you start to take a look, and you can view and also have your digital ID card right there in the Sydney Health app, but then also when we start taking a look at getting access to care. I'll talk about that in a little bit, but one of the enhancements and really the amazing benefits we have with virtual medicine, you're going to access that directly through the Sydney Health app, but I'll talk about that in a couple slides too. So Jay made reference, and we know that you have a culture of wellness here, especially with that you've been engaged in utilizing Go365. We do have a solution for that. It will be a little different, since it is a new company, but it's going to be integrated inside your medical insurance plan. So whether it's become receiving incentive and rewards for getting engaged in your health and well-being by utilizing services under the medical plan, making those better healthcare decisions and choices, as we made reference to doing the research before the services are rendered, that you'll have access to all that information. Helping to set your health goals, where we still have health coaching that's available as part of the program as well. And then ultimately trying to save some money, not money out of your pocket, but then in all efforts to make some changes to how the plan itself is making some utilization to their coverage. Our solution to a workplace wellness incentive program is what we call our Engagement Package 200. So this is integrated and it's available to you if you enroll in the benefits. And this is also a benefit your spouse that is also in the plan would have access to this information as well. This is not for adult children and not for minor children that are on your plan today. As you start taking a look at that, we have broken out into 3 different buckets, the first being preventive care, then condition management and wellness. Preventive care, so through utilization of your benefit program, you would receive incentive and rewards for doing things that you really should be doing on a regular basis or as your doctor has prescribed. So going for your annual wellness exam, you would after that claim processes, that gets then sent over and you would be eligible to have a $25 reward that's put into an incentive bucket. I know with Go365, it's calculating those points, and those points turn into bucks. It's even more simple than that. If you go for the exam, it runs through the system and it runs through the claims system, that would be a $25 value. Now, on the Sydney Health app, or also on anthem.com, you will be able to go to underneath the wellness section and you'll see how you have accumulated and aggregated all of the rewards and incentives as part of the wellness. You would be able to redeem those online, and it comes to you also as an e-gift card. Go365 had gift cards or merchandise. Inside the Anthem engagement program, that's going to be where it's only e-gift cards, but it's to a series of different online retailers that you would be able to send over and redeem. Yes, ma'am. Is the information in the booklet? It is. It's page 28, yes. So inside the booklet here as well, this chart is located in there. And as you see, beyond the preventive care, we also have the condition management. So it is providing some incentive to engage with health plan coaching, which will be available through the wellness portal. But then also, as we start taking a look at tracking those steps, through the Sydney Health app, you have the ability, again, to sync up your fitness wearable, if you will. I wear an Apple Watch. I have my Apple Watch connected to Sydney Health, so as I'm moving around throughout the day, I'm tracking my points so that I can gain some incentives towards the end of the year. Or as I gain those, as I get the 50,000, I'm getting those dollars actually awarded to me. So it is very different in concept. I know Go365 allowed you to have different activities that you could do. Like let's say you went and did a blood drive, or you went ahead and did a 5K walk or a run. You could submit those points with Go365. This program is much more simple and much more simple to engage with, and it's going to be based upon your utilization inside the health plan. This does not include biometric screenings. Our relationship, and we feel it's so important for you to have a relationship with those clinicians and your doctors, it's all forcing information and having you engage with your medical provider in order to have those regular routine wellness exams. So we'll spend more time as we're going to work with Nikki and Mary further into the year. Capri is an absolute wellness expert, so we're very lucky to have her connected to the county as well. All right, Live Health Online, you'll also see it referenced throughout the material as LHO. Live Health Online is one of our in-network providers that focuses on only offering virtual care and virtual medicine. You're probably familiar with this because this is also known synonymously as telemedicine. We call it virtual visits here at Anthem. Live Health Online is the opportunity for you to engage with a medical provider. It's available to you 24 hours a day, 7 days a week. Your plan covers these types of services at $0 copay, and it's no deductible applies. And that's going to be the same for medical services, but then also a great enhancement being for behavioral health services as well. I know you have the amazing resources with your care clinic that's nearby. This is meant to supplement that, not in exchange for. But what's great about this is that the true access to care and having that opportunity to connect with them virtually. If you have a dependent student that lives outside the area, you're going to want to make sure they know about this because this is an amazing resource. Inside the medical arena, that's going to be very similar to what you would normally go to an urgent care facility. So if you have a common cold or flu, strep throat, pink eye, those types of things that you know that you just need to talk to a clinician. If you need a prescription, they will work backwards with your pharmacy. You'll be able to select which pharmacy you would like them to send that prescription over to, and then you'll just go about your day. It's available, it's meant to be urgent care, so it could be in the middle of the night, it could be first thing in the morning on a Saturday. You'll be able to dial in and you go into what's called a virtual waiting room. The next doctor that's available, you'll go in and you'll have that actual virtual visit. It's done on the mobile app on your phone, or you can do it at a desktop computer or laptop as well, as long as it has a camera. So you'll have that from the medical side. Now, your benefit plan also includes behavioral health services. Why this is so important to be able to talk about this, because we know that not only here in Wisconsin, but really nationwide, there is a drastic need for more access to care points. It takes a long time to establish as a new patient. You're talking 6, 7, 8 months, 6 months in some instances, in order to be able to establish regular routine office visit appointments. Live Health Online has a whole network of different clinicians, so it's going to be licensed social workers, psychologists, and psychiatrists, in fact, when you start to take a look at who you may or who your dependents may also want to be able to seek services with. Now, the behavioral health side is distinctly different than the medical. Medical is meant for urgent care. You go in the virtual waiting room, you get the next person. On the behavioral health side, it's most impactful if you can establish that relationship with that one care provider. So you're going to set appointments, and your appointments will be future dated as well. You'll be able to have the appointment, make an appointment in the next 2 weeks, maybe a month down the road, and you'll establish that rapport with that one specific clinician. If you and that person don't jive, no harm off their back. So you'll go ahead and they'll share a listing of the different providers that you will also still have access to, and you can just as easily make that appointment with that next provider. So the access to care is super impactful. This is available to anybody on your plan. Live Health Online will go down to age 12 for your dependents. If it's below age 12, you still have resources under your medical insurance plan, but for virtual medicine, there's just some guidelines of who would be an acceptable patient. Yes?
So I don't know if it's as important like with the urgent care part, but with the behavioral health and you providers, do they have access to previous
Call notes or something?
Yeah.
The question is if you, like on the behavioral health side, if you didn't jive with that one provider and now you switch over to somebody else that's also in network, they would be able to access and share those records through some of the medical reporting. Good question. So there is more information about Live Health Online, but I spent so much time talking about it because it has really become a very revolutionary process. It's quick and easy from an access perspective, especially on the behavioral health side, just knowing you have additional resources available to you and your family. In addition to all of those other online resources, just know that you will also have continued support for managing your more serious or also your regular chronic illnesses as well. Anthem will be reaching out to you. It's a completely voluntary process, but we want to make sure that you know that you have case management set up behind the scenes to help navigate through some of the more challenging situations that your family are going through. They're here to help answer those questions, coordinating the care with your doctors, setting appointments, making sure referrals are sent over, doing a lot of that access for you up front. They're going to show you how to best use your benefits, educate further on health issues, but then also provide those tips on saving money. We mentioned about the cost transparency tools, but there also might be community resources or resources from the prescription drug carrier as well. So we're here to help out and help navigate through that process through our case management team. Now, those might be for the more serious health conditions, but we know that there are many of us that just really struggle and challenge with some of our more chronic conditions that we have. For example, our asthma, diabetes, heart disease, COPD. These are things that individuals are challenged with every single day. Anthem has more resources to be able to provide and be able to help navigate through some of those, in addition to support system with medication too. Now, one of the great programs that I like to discuss is a partnership with a third party. Now, this is our solution to a diabetes prevention program, or a DPP, if you've ever heard that acronym. We have a partnership with LARC. LARC is its own freestanding organization, but LARC is here to help you with prevention of a diabetic diagnosis. What this does is that you'll have access on Sydney Health. You're going to complete a quick little 30-second survey to see if you qualify for having a LARC specialist reach out to you. Now, inside LARC, what you can expect is that it really is going to be that ongoing coaching with the focus of losing weight, managing your stress, eating healthier, sleeping better, and then increasing activity. Through a myriad of different things that you could do within the program, it's going to reduce your opportunity and the chances of developing diabetes in the future. Your doctors will work with you. Your doctors will have heard of this for sure. This is definitely a well-known resource inside the community. Your doctors will be able to talk to you about LARC as well, but just know that it's covered under your benefit program and no additional charge. Inside your medical plan too, we also have an employee assistance program. It is for virtual visits. This can be also used as a supplement to your freestanding EAP services that you have with SSM, as Jay mentioned before. Just know that this is available to you and your families, even if they don't live inside your household. One of our newer programs, now I say newer, it's been, if anything, just reinvigorated and renamed. We're now calling it our Building Healthy Families. It formerly was known as Healthy Mothers, but we've identified that through just the courses of life, no longer is it just making sure that the pregnant mom is taken care of when they're building out their family. We understand that there are struggles with infertility, there's adoption, there's placement, there's all these different myriad of issues. What we do is focus on helping to support the family with the resources and the needs that they find best. It's available, once again, it's completely voluntary, but just know that you have the resources available to you 24 hours a day as well. So it's going to be viewed on Sydney Health, but then through that, you'll be able to get additional information and content about how to develop the relationship with that coach. Special offers. Also, towards the latter part of this book, by being a member with Anthem, you will be eligible for some different discount programs from a whole different series of different things that you could be utilizing inside your household today. Whether if it is for some more cosmetic services, like maybe some Invisalign, or perhaps some teeth whitening, those types of services that are not normally covered under your benefit program, but you may be able to have also for some discounts from Anthem. We also have some different health. We also have some weight loss programs, some fitness programs, just knowing that you would have access to this just by being a member with Anthem. There's no additional cost for any of these things outside of the cost that it would be having after the discount is applied. Contacting member services. This is a nice flag here that the member services number on the back of your ID card. So speaking of ID cards, everybody that joins the plan will receive a new ID card. We're striving to have those completed by the middle of December. If it's sooner, that's fantastic, but we want it to be closer towards the first of the year just so they don't get misplaced. But if they do, just let us know and we'll order some duplicate cards. If you enroll with more than one person on your plan, so if you enroll with family coverage, what you can expect is that every single member that's on your plan, your spouse and your dependents, everybody gets their own ID card. So for my family, I have a family of 4, my spouse, my 2 kids. I have 4 ID cards floating around. My spouse carries his, and I carry mine for my 2 minor kids. But ultimately, I don't carry it around all that much because I have my Sydney Health app, and then I always have access to that virtual card. That if I need to get it over to the doctor's office, get it over to the pharmacy, I can go ahead and take a picture and email it into the system. Works really, really slick. On the back of that ID card will be that member services number. So once you get that ID card, you can start calling in to member services. However, on the right here, registering online or downloading the Sydney Health app and having access to your plan information, that will not be until January 1st. So the digital and the online resources are not available until January 1st, but you can start calling member services once you get your ID card in hand. And why that's important, as Nikki had mentioned before, that there could be some instance that you either have a prior authorization, you need your doctor to start calling in and working with our medical professionals at Anthem, or you maybe have a question about the transition of a new prescription. You can start that process before the first of the year by utilizing the member services number, along with what your providers would be able to do as well. Any questions about anything? Yes, ma'am. Where it starts about the deductible? Okay. Yes? So inside, this is what we call our summary of benefits, or SOB. I know acronyms are terrible. Summary of benefits here. So in the middle section here, it talks about the deductibles. So the family deductible and out-of-pocket limit, which are embedded. Now, Jay made reference to a great enhancement we're making to our plan, where it's now going to be a combined out-of-pocket limit for medical and pharmacy. But what it means to have an embedded deductible is that if you have enrolled with family coverage, yes, your out-of-pocket limit is $9,000 for the family, but because it's embedded, the most that one person in the family has to pay is equal to the single. So if you have so let's say my example I already shared, I have 4 people in my family. I go and I have to have knee surgery. I know that I'm tracking towards, I have therapy, I have everything that's incorporated there. I would meet my $1,000 medical deductible, and then it gets applied to that out-of-pocket limit, and then I still have the additional up to the $4,500. Now, after I've met $4,500 for myself, all of my services that are then covered at 100% thereafter. And then the rest of my 3 members of my family would have the other $4,500 towards that $9,000 limit. Exactly how your plan was today, because you still had those embedded single and family deductibles in those accumulators. It's just different now because we've combined the medical and the pharmacy. Does that answer your question? Yes.
So when we go, like, for example, a same page where it says primary care or whatever, your regular doctor, $25 copay per visit, you don't, sometimes, and I can't remember if it was this or before or what, but you get like the whole, at the beginning of the year, January 1st, you go, or January 2nd, it'd be a $300 office visit, and that went completely to your deductible. Now, is it just $25 copay and then the rest doesn't go to the deductible?
Would it be different?
I think that's how it was this year, but I feel like it wasn't like that before.
So,
With UMR.
okay, so this year, so on the doctor's office visit, it was a $25 copay, plus then your deductible and co-insurance kicked in. Okay, so you'd pay your $25, but then the balance would still apply to your deductible that you'd have to pay. With Anthem, that's not going to happen. You'll pay your $25 copayment, and you are done with that bill.
Oh, okay.
All right. The other thing with copays that I didn't mention that's an enhancement, today your specialist copay and a behavioral health provider would be a specialist. is $50. With Anthem, it's going to be $25. And again, no deductible or co-insurance after you've satisfied the co-payment. Any other questions before Anthem? Jury, was there a hand raised back there? Okay. No. That's the direct answer. But with that Anthem, I believe with Anthem special offers, you can get gym discounts.
Yeah, there should be some more nationwide gyms that might be eligible for discount under that special offers.
Okay. Yes?
I just have a question on the name of the plan. Sounds like County Anthem.
That's just the insurance company being stupid. They have to code everything. That's just their product label for it. So it really doesn't, it would not mean anything to you. What?
Just want to make sure it was an additional 1,000.
No, they have 1,000 in its label because it's a $1,000 deductible. And POS, point of service, that's no different than from a benefit construction, that's no different than a PPO. It's just a different acronym for the same thing. That's just basically saying you have benefits in and out of network. Okay. Want to add something as far as your ID card. So again, make sure that when you get your Anthem ID card, the first time you see your pharmacist, first time you see your doctor, first time you have a health service, remember, if you don't have that Sydney app with you or you didn't download that, have them make a copy of your ID card so that they know your insurance has changed. Also, Anthem's only responsible for your claims starting January 1st. So some of you will have claims or for services this year yet or earlier that are not going to get paid until after the first of the year. So keep your Dean ID card in case you have questions or have to deal with customer service on a Dean claim. Because anything that was provided, anything that was incurred prior to January 1st is Dean's responsibility. Okay. Yes.
It was just a question about the reward plan. So if you had said that it's going to talk among, if you have a claim that you go to an eye exam for, and it's a claim that it's going to talk and upload those points, those dollars, those bucks. What if you go and have a flu shot and you're not having a claim, I guess, generated for that? Is there a way or a tool that we can then upload our whatever it may be?
So the question was about the Engagement 200 package inside here, because there are going to be some plans, and I did make reference a few times about it needs to run through your medical insurance plan in order to track towards the engagement incentives. So if it does not run through there, there is not a supplemental way in order to get this over to be able to receive reward under the plan. Now, within scope of that, if you go to like a freestanding pharmacy, like if you go to a Walgreens or something to that effect, you're still not paying because it's considered preventive care, but they're still running it through the insurance. We are working together to work with the near-site clinic to see if there might be the opportunity to be able to run those claims through our system as a $0 preventive service, but we're still trying to work out to make sure we can do that. Because I know there's a lot of these different type of routine or especially the immunizations that you might be doing that at the near-site clinic. So I don't know if that answers that question, but ultimately it does need to be run through the medical insurance plan in order to receive any of the incentives. Is there a question over here, perhaps?
Is there a list somewhere of the specialty care
What type of specialty care is authorized? You might be able to find more information inside the summary of benefits, where it might list out more information about like chiropractors, manipulations, therapies, those types of services that would be covered under the plan. This would be a good starting point, but then you also would have the opportunity to call into member services to quote out benefits. We'll let Jay finish out the rest of the presentation, but Capri and I will be here afterwards, so if anybody has more specific questions.
Okay, so just a reminder, the dependent care and the flexible spending account, you do have to re-elect your contribution, re-elect online. Also plan carefully, because I think some of you, at least that have used it in the past, know that there's a use it or lose it rule. So if you have money left over, you're going to lose that. However, there is one safety net for you under Fond du Lac County's plan. It's a 2.5-month grace period. So let's say end of this year, you've got $400 left. You can actually use a covered expense from the first 2.5 months of next year and apply the unused dollars from the previous year. All right? So remember that in case you have money left over. You have 2.5 months to have a service or make a purchase that's eligible for reimbursement to use previous year's funds. Great way to save money too. I know some of you have benefited from it that way, but prescription drugs is really the easiest example. So let's say you're on 2 maintenance medications, one for high blood pressure, one for high cholesterol. You've got a $15 copayment on your plan, assuming they're both generic, which they probably would be. That's $30 a month, all right? $30 a month is $360 a year. You're going to save at least 30% because of the pre-tax contribution scenario, and that will save you $118 or $108 for the year. So easy way to save $100, just in that one little example. If you have a planned surgery for next year, some type of an elective surgery, you have an idea what it's going to cost. You can put up to $3,200 away. You just save 30% on your out-of-pocket expenses. And we still will have a debit card or the Benny card. Do you like that card or not? You do? Okay. So that will continue. Again, for vision, no change in benefits, no change in premiums. And with vision, it is open enrollment. So if you're not taking coverage today, you can elect in it for 2024, either the materials only for people who have the health insurance, because you do have vision exam coverage under your health insurance with Anthem as well, or you can take the materials or the full service option that includes an exam, and the vision premiums are pretty small compared to the benefits that are provided. Anybody tell me why it's important to get a vision exam, whether or not you have the coverage or whether or not you wear glasses every couple, 3 years?
Detect more than just eye.
Yeah, something like over 100, or might even be over 500 different diseases or illnesses can be diagnosed through a vision exam. MS can be diagnosed through a vision exam. And the reason for that is it's the one time, only time, a doctor can look into your body without cutting you open because of the veins in your eyes. Well, it's supposed to be. We've had some problems this year, that I know. But it is covered under Anthem as well, or will be.
Anthem gonna cover like Shopko?
Yep, so the question with Anthem covers Shopko, for example, for our routine eye exams. Your plan will be utilizing it's a separate network for your vision routine eye exams. Still underneath your medical, you're going to give them your medical ID card. A preventive exam is covered one time per year, regular routine exam, but it also includes refraction, which is going to be the important part so you get a prescription afterwards. We utilize our Blue View Vision, which in essence is an iMed network. So it is a broad network. It has independents, but it also has retailers. I believe Shopko is, I can double check that, but I believe that Shopko Vision is part of the Blue View Vision. Because it is a larger network. It's going to be larger than what you're probably used to, especially under your current plan, because you would have been just using your medical providers. That would be treatment of eyes. So these are individuals that can do the regular routine eye exams, but utilizing a vision insurance network underneath your medical insurance plan.
So it was just this year we could get the eye exam.
Is SSM Shopko?
No.
Okay.
So Shopko's in network. The difference between what you have now and Anthem, and the Anthem experience will be much better. So Anthem also sells vision insurance. Now, we have NVA, we don't have Anthem, but because they sell vision insurance, they have a network to support that product. That's the network you can use to get your vision exam underneath the medical plan. So when you're searching for a vision provider for a vision exam, you will look up a different network. You'll look into a different network option online when you're looking at where you could go for your vision exam. Does that help?
I just want to go to one place.
Yeah, you can go to just one place. And then, as I said, your dental benefits are staying exactly the same, except for that porcelain crown enhancement to back teeth, and your rates are staying the same for 2024, and vision and dental are both subject to open enrollment, so dental as well. You can take it now if you're not participating. You can drop it now if you don't need it or want it anymore. It is subject to open enrollment, just like the medical plan is. Any questions on your vision or dental programs? There are prizes for participation, by the way. So, long-term disability insurance is really not part of open enrollment because the only thing you can do during open enrollment with your long-term disability insurance is if you're already enrolled, you could change your waiting period. You can go from a 30-day waiting period to a 90-day, or vice versa, go from a 90-day waiting period to a 30-day waiting period. If you are not taking long-term disability insurance today and you want it, you're going to have to fill out an evidence of insurability form, which again is available online at the HR department website, or you can take that form with you when you leave today if you want to try and apply for long-term disability. So, if you don't want to change anything, you don't have to do anything. If you do want to make changes, you're going to have to acquire the applicable form either online or when you leave today. And again, everything has to be done by 3 o'clock on November 15th. Any questions? Yes?
So this year, if I have single coverage
Yep.
and I reached top level for the lowest premium for next year, but I'm going to switch to family coverage, do I stay at that same level of premium?
Yes. Yep. Yeah, getting married is not a penalty. Yes?
I just have a question about, is Aurora and Fond du Lac covered? They didn't list them specifically on that little summary sheet.
It will be. Yeah.
Sheboygan and all these other surrounding.
Yeah, Aurora in Racine, Kenosha, Aurora, Milwaukee, Aurora, Green Bay, Aurora, Sheboygan, Aurora, Fond du Lac, Aurora, Oshkosh.
Okay, thank you.
Yep. Anything else? Okay, a couple more things. I just want to give you a couple tips to save money if you're on prescription drugs, because I told the first group this because some things came up. But you might want to think twice about getting prescriptions filled at Walgreens versus getting them filled at Ignesian or at CVS. Unless they stopped doing this, I don't know that they did, but Walgreens had always been notorious for charging your copay even though the drug actually costs less. Because under your benefit programs you've had here, you have a lower of hierarchy, all right? Meaning you pay your copay, or if the actual acquisition cost of the medication is less, you'll pay the lesser amount. Now, what Walgreens had done in the past is they had put provisions in their contracts with payers like Blue Cross, Navitus, United Healthcare, who we used to have, that they get to charge the co-payment and keep it. So let's say you go fill a generic medication and it costs $5, they will charge you $15 and keep the $10 difference. All right. Second thing, and this is just because I had a recent experience, and I don't know the average person would think about doing this, but about a month ago, my doctor put me on Eliquis. Some of you know what that is, right? So now I gave you all my PHI. And it was kind of funny because that afternoon I had a meeting with a client, and one of their most expensive drugs in their previous year's utilization was Eliquis. It was about $600 a pop for a prescription per month. And I went and looked on, because I wanted to see what I was possibly in for, because I have a high deductible HSA plan that I have to pay up until my deductible is satisfied. And I looked on GoodRx just to get an idea of the price point, and sure enough, it was $580 to $620, depending upon the pharmacy. So then what I did is I went out to Pfizer's website, the manufacturer, and I registered for a coupon card or copay card. So when I went to pick up my prescription, under my benefit plan, it was $100. I would have had to pay for it. But when I showed them that Pfizer information that I had on my phone, it cost me 20 bucks. So I saved $80 by doing that. Now again, you have fairly low co-payments, but even on a $45 drug, so let's say a preferred brand is going to cost you $45, with that coupon or copay card, you could save a good chunk of that. You might be able to save 20, you might be able to save $40. All right, so just keep in mind to do that. You don't have to know who the manufacturer is. All you have to know is the name of your drug, and just Google patient assistance for, Eliquis. All right. Anything else?
Just another reminder, folks, we are changing carriers this year. So again, I'm gonna stress, if you have a prescription in December that you need to take a look at, please don't wait until you have 2 pills left in your bottle on December 30th and just make the switch for your prescription. Because we're changing carriers, that does change the formularies. Just make sure you're filling your prescription in time. We ran into a lot of problems at the end of the year for some pretty serious medications, okay? The second thing, just to tie into what Jay said, I learned this from Aaron today. Again, once we are officially Anthem on 1/1 of 24, I highly recommend downloading that Sydney app. She taught me today that if I have to pick up a prescription, I can look it up and see what they're charging me at Walgreens versus what they're charging me at Target and vice versa. So it is all about transparency. I know formularies are a very expensive thing. And to your point, Katie, I just want to talk about formularies. Please make sure that you're going online and doing your research with Anthem. They do have the list out there. I know we've got some hot buzz drugs going on right now, Ozempic, Manjaro, something like that. But we have a lot of medications that apply to one type of preventative disease like diabetes as opposed to weight loss. Some of it might be covered for one thing and not the other. So please make sure you're doing your research on that, because I want to be transparent about that piece as well.
Yeah, so the situation with Ozempic, who's heard of Ozempic? Yeah, most everybody has by now. It's probably the hottest drug talk this year, because what has happened in the last 2 years is physicians are prescribing it off-label for weight loss. And what I mean by prescribing off-label, the FDA did not approve it for weight loss, they approved it for diabetes. So even if a plan covers weight loss medications, they usually have to be, or almost always are, pre-authorized for need. Well, Ozempic was slipping through the cracks because it was coming in as a diabetic indicator, even though it was being prescribed in situations for people that were not diabetic. And it is it's become very popular for weight loss, and it's also become kind of a bad story for people that really need it, diabetics, because there's a shortage of it now, all right? So starting with Anthem, and this probably would have happened with Navitus as well, but starting next year, Ozempic will not be covered unless you have a diabetes indicator, unless you're diagnosed with diabetes, have a claims history relative to diabetes.
Okay. So again, the Anthem website has all that information. If you're looking for eye providers, if you're looking for doctors, if you're looking for formularies, and you want about that nitty-gritty, Anthem is. Yes, ma'am.
Is there a website for the new mail order pharmacy, or is it, I saw in the booklet, like you have to call the first time you want to set that up?
Yeah, it's Caroline.
It's Caroline RX. You'll have access to it on anthem.com after the first of the year, once you have access to your benefits.
Through the app as well, that's email?
That's correct, through the app as well.
Good question.
And speaking of apps, who uses Fond du Lac County's benefits app? You know, we spent a lot of time putting that in place here. But that's another good app for you as a resource, because that app is a wallet of many or most of your benefit programs here, so you can look at it as a quick resource. It's also a place to take a picture and download your identification cards. We will have that app updated in the near future with the change to Anthem and some other new things that the county wants to put out there. So urge you to download it, urge it to use it, because then you have everything at your fingertips as far as what you have for benefits here at the county, in case you have any questions. All right, thank you for your time.